Okay, and then next slide. So I think this is our last slide before our presentation today. Today's session is primarily sponsored by our San Diego HIV Implementation Science Hub, and we wanted to raise your awareness to some of the additional resources through not only our hub, but through the network of hubs that form what is called Cheshire. So Cheshire is the capacity building hubs to enhance the science of HIV implementation research. Cheshire includes all of the funded HIV implementation science hubs. In this circle in the middle of the figure, you can see all of the universities represented. They include UCLA, University of Washington, Emory, University of Alabama, Johns Hopkins, UC San Diego, Yale, and UT Health. And they're coordinated by a coordinating center at Northwestern. But we, through all of these hubs, we can offer a number of different resources and tools, including consultation, coaching, capacity building assistance. Um, Cheshire does have an intake form, so if you or any of your colleagues are interested in getting some consultation from us or any of the hubs in a variety of different methods, you're welcome to fill out an intake form. So please do scan the QR code if you'd like to get some more information about Cheshire. And I think with that, I'll go ahead and introduce our speakers for today. So I'll start with introducing my colleagues, and then I'll do a brief introduction about myself. So joining us today, we have Dr. Catie Willging. Dr. Willging is the Center Director and Senior Research Scientist at the Pacific Institute for Research and Evaluation, and a medical anthropologist specializing in health and behavioral health services research. She leads community engaged mixed methods research on how structural inequities shape access, quality, and equity in care for underserved populations, generating actionable evidence to inform policy, support organizational change, and address health disparities. Also joining us today is Dr. Elise Jaramillo, who is a cultural and applied anthropologist studying environmental and public health disparities for racially and socioeconomically marginalized populations. Dr. Jaramillo has undertaken applied anthropological research on access to healthcare and insurance for American Indian seniors, and implementation science studies on evidence-based child welfare intervention. And then, hi everyone, I'm Nicole Stadnick. I'm an associate professor in the Department of Psychiatry at UC San Diego, a research co-director of the Child and Adolescent Psychiatry Division, and I co-direct the ACTRI Dissemination Implementation Science Center and the San Diego HIV Implementation Science Hub. My program of community engaged research focuses on co-creating social solutions with health systems and communities to adopt, scale, and sustain evidence-based care. I'm just delighted to be presenting with Catie and Elise. We recently co-authored a chapter in the Mixed Methods Research Encyclopedia that should be coming out later this year about ethical considerations in mixed methods implementation research. So we're excited to be able to share some of our thoughts about those topics. So with that, I will ask Anna to share our presentation slides, and then Catie is going to start us off in our presentation today. Okay, thanks so much.
Great. Thank you, Nicole. In full disclosure, back in the day when I was a postdoc at UNM, University of New Mexico, part of my training focused specifically on research ethics. So I was delighted when you invited Elise and I to participate in writing the chapter that serves as the basis of today's presentation. And today, Nicole, Elise, and I really want to kickstart a dialogue about ethics and mixed methods implementation research, naming some key issues and offering practical ways to make mixed method studies more reflexive, transparent, and equitable. I also want to acknowledge that we had some help creating these slides. I believe Copilot was likely the AI agent at play here. Next slide. So here's a preview of today's discussion, grouped into three areas: power and bias within research teams, balance and transparency in producing and reporting results, and inclusive and ethical involvement of human subjects. Next slide. So why does ethics in this work matter? First, mixed method studies combine forms of evidence with different standards of rigor, analytic logics, and expectations for engaging participants and interpreting data. Second, team-based work can bring power differentials within multi or transdisciplinary teams into clearer view. Third, participants may be asked for more time, information, and emotional labor across, the multiple research activities that we invite them to complete. Finally, tailored ethical guidance remains comparatively limited despite the growing use of mixed methods approaches in a wide variety of research arenas, including implementation research and, health services research more generally. Next slide. So before turning to the ethical issues, I just want to briefly orient us to mixed methods. Quantitative approaches often emphasize measurement, statistical analysis, and patterns across cases, while qualitative approaches emphasize meaning, context, and lived experience. And these approaches are commonly associated with different research paradigms, different traditions. Positivist traditions foreground measurement and explanation. Interpretivist traditions, for example, focus on how people make sense of their experience. And transformative traditions foreground power, inequity, and research aimed at social change. These distinctions are not absolute, but they influence what researchers tend to treat as evidence. The defining feature in mixed methods work is integration, using both types of data to produce a fuller understanding than either alone could achieve. The tension is that paradigms emphasizing evidence, rigor, and voice do so. They value these things differently, or approach these things differently. So integration requires ethical choices about whose evidence counts and how findings are represented. Next slide. Oh, that was okay. No, here's our roadmap. You can go back to that slide, Anna. So here's our roadmap for the 13. We're going to cover 13 ethical issues today. The first category, as I mentioned, examines power and bias within the research team itself. The second turns to balance and transparency in the reporting of results, including how teams manage seemingly discordant findings, reporting standards, and authorship. The third addresses human subjects concerns, from recruitment and consent to burden, privacy, and provider participant dual roles, where service providers may also recruit clients, deliver the intervention, or contribute data. We've grouped these issues for clarity, but in practice, they overlap. For all three categories, keep these cross-cutting themes in mind: reflexivity, transparency, equity, and accountable decision-making. Next slide. Okay. So category one centers on power and bias within our research teams. These issues are ethical because the perspectives and priorities within a team shape the questions we ask, the methods we choose, and the conclusions we treat as credible. Power can show up through leadership roles, disciplinary status, funding decisions, or whose voice carries weight in meetings. The recommendations in this part of our presentation emphasize reflexivity and making researchers' priorities and intentions explicit. Next slide. So the first issue is positivist bias. Many mixed method studies, especially in health services and implementation research, are shaped by positivist assumptions about objectivity, causal explanation, and what counts as strong evidence, although we're increasingly questioning these assumptions. However, when that type of framing dominates, researcher bias can be harder to see. For example, teams may give greater weight to quantitative outcomes while using qualitative data mainly as an add-on to explain or confirm those findings. A key response is to practice reflexivity across all strands of the study, including its quantitative components. Reflexivity asks researchers to examine how their identities, roles, priorities, and institutional contexts shape methodological choices, analysis, and meaning making. One practical strategy described by Erin Finley and colleagues is periodic reflection. So these would be scheduled discussions throughout the study to revisit starting points, identify strengths and weaknesses in the protocol, consider needed adaptations, and document how these reflections affect research decisions. Next slide. So what does reflexivity look like in practice? First, positionality matters, but positionality statements are strongest when tied to concrete research choices rather than treated as required disclosures. Training roles, lived experience, privilege, and institutional incentives shape what researchers notice and treat as credible. Second, build the periodic reflections just described into the workflow, using regular debriefs to revisit methodological and analytic choices and emerging tensions. Third, collaborative reflection, so not just within the research team, but even more broadly, means inviting participants or community partners to interrogate our findings, including by questioning our underlying views, offering alternative explanations, and identifying what may be missing, not simply confirming the team's, authoritative reading of the data. Finally, document and report how these conversations affected your study. Reflexivity should be ongoing, structured enough to be actionable, and flexible enough to leave room for unexpected insights. Next slide. So reflexivity means noticing what researchers are treating as important from the start. For instance, investigators may initially focus on symptom reduction or service outcomes, while community partners, providers, or participants may emphasize safety, trust, and manageable study activities. This can be especially important when distress, instability, or other circumstances can make study activities more demanding for participants. Reflexive practice means pausing early to ask whether those priorities fully fit the study context, including whether long surveys create unnecessary burden. It also changes how findings are understood. For example, if participants drop out or only partially complete a survey, the research team would not implicitly blame them. Instead, the team would ask whether the study activities fit their needs and circumstances. The point here is that reflexivity connects priorities, study activities, and analysis before hidden judgments turn into biased findings. Next slide. The second issue concerns hierarchical research structures. These projects commonly include principal investigators, faculty, staff, trainees, methodologists, and community or lived experience partners. These arrangements are often hierarchical for practical reasons. So grants, IRB oversight, supervision, timelines, and methodological standards all require clear leadership and coordination. And this is not inherently problematic. The ethical issue is when hierarchy silences concerns. That can limit people's ability to speak up, weaken analysis, and allow participant or community risks to go unnoticed. A key response is to cultivate psychological safety, normalize disagreement, discuss issues and mistakes constructively, rotate facilitation, and create real opportunities for junior or less powerful contributors to influence decisions. Next slide. And psychological safety refers to a shared belief that people can speak up without fear of punishment or humiliation. When it's absent, less senior researchers may withhold concerns. Methodological experts may defer to the strand or the discipline with more, institutional authority or authority within that team or imputed authority. And community partners' feedback may be discounted. Over time, these partners can allow concerns to go unaddressed, contribute to burnout, and reinforce inequitable research practices. Building psychological safety requires intentional action from leaders and collaborators, framing mistakes as learning opportunities, modeling uncertainty, creating norms for constructive critique, and recognizing contributions fairly. And this is a research ethics issue and not just a team management issue. Next slide. And the third issue is methodological imbalance and under-resourcing. Mixed method projects can become ethically problematic when one strand is treated as secondary or included in name only. For example, a qualitative or quantitative strand, or the integration work itself may be underfunded, rushed, or treated as supportive rather than as essential. These problems can lead to misleading conclusions and devalue contributors' and participants' expertise. A practical response is to resource each strand equitably, with allocation guided by the study's overall design. In practice, that means training staff, using quality check procedures or protocols for both strands, clarifying each method's contribution, and reviewing resource allocation early enough to make meaningful adjustments. And next slide. So to pull all these three issues together, power dynamics within the research team can shape whose expertise counts in planning and analysis. Different contributors may emphasize different priorities, such as measurable service outcomes, intervention fidelity, safety, trust, feasibility, or participant burden. If some concerns carry less weight, they may not influence the measures, your interview guide, or what the study ultimately asks. Engagement problems can then be framed as individual behavior. Missed appointments, incomplete surveys, or difficulty following a treatment plan, rather than as signs that study activities or context created barriers, such as transportation, inflexible appointment times, privacy concerns, childcare needs, or emotionally demanding tasks. Inclusive practices help catch these unspoken priorities early, adjust burdensome activities, and produce conclusions that are fairer and more useful. And now I am going to turn us over to Nicole as we move to the next slide.
Great. Thank you, Catie. So I'll be talking now about our category two issues, of which there are three. And this category focuses on balance and transparency in the production and dissemination of our results. And so these issues really relate to the producing, reporting, and sharing of our mixed methods research findings. We have corresponding recommendations to promote clarity and transparency in how we represent our research findings and how we think about authorship when it comes to dissemination. Um, these next issues, we'll present them in a similar way. We'll share kind of the call out of the issue and then a response in terms of our recommendations. I do want to welcome you all as you're listening to us to be typing in the chat or just kind of taking notes of your own that we can spend some time discussing at the end about if these issues resonate with you and if our recommendations, do you agree with them? Do you disagree with them? Are there other recommendations that you might have to tackle some of these issues? Okay, next slide. So issue five, but the first issue in the category of balance and transparency relates to inconsistent or incongruous findings. So, our quantitative and qualitative findings in mixed methods research may or may not align, um, despite there may be a pressure to produce very clean, positive, aligned results. And our findings that may differ from between our quantitative and our qualitative data may reflect real differences in what's been studied, our data, the context of our data, and the way that we analyzed those different sources of data. Inconsistency in our quantitative and qualitative findings can be sometimes perceived as a problem that we need to eliminate. or sometimes we think of it as not analytically valuable. But that really highlights the beauty and the real value of mixed methods research. So for me, it's really sometimes exciting if we have divergent findings from our quantitative and our qualitative research. That really shows that what we're trying to study is complex, and we need this kind of differing ways of producing knowledge to really understand the topic that's being studied. So here are some of our recommendations to address this, you know, uh, issue of inconsistent findings. We want to try to generate a culture of normalizing expectations that findings need from our different methods need to be uniform, and that inconsistency is inherently negative. We want to acknowledge that quantitative and qualitative data may offer very different findings, and our job as mixed methods researchers is to integrate those two sources of data into a meaningful way. And by doing so, that might prompt deeper exploration and new insight. We also recommend being willing to disclose the messiness of our mixed methods research, including the interpretation of those data. We encourage open discussion of the divergence in publications and presentations. And again, we want to just emphasize that one of the main values of mixed methods research lies in its ability to unearth complexity. Next slide. Okay, our next issue number 6, but second issue within the balance and transparency category, relates to reporting standards and transparency tensions. So, our quantitative findings are typically judged by validity and reliability, while our qualitative findings are judged by credibility, if they're generalizable, and if we can confirm them. Reporting checklists are necessary, but not always sufficient to guarantee transparency, rigor, or ethical quality. They may oversimplify qualitative processes, reduce nuance, and just sort of oversimplify again the process of qualitative inquiry. So standing reporting conventions, again, are necessary but not sufficient. So we have some recommendations of how we might be able to enhance our reporting, our qualitative research, and really our mixed methods research. So as Catie did a really beautiful job already kind of highlighting the importance of reflexive practice, we wanted to just highlight a few other opportunities for reflexive practice as it relates to reporting standards. So we recommend naming how positionality and our relationship to the data shape how we're interpreting findings. We recommend writing in a clear voice rather than in fake objectivity. We recommend staying alert to the risks of speaking for participants or communities. And one way to do that, if at all possible, is to include your community collaborators as co-authors in the reporting of your findings to make sure that their voices are very clear in dissemination. We also want to advocate for more journal space for ethics and reflexivity, especially with our mixed methods research. Um, Oftentimes, we are subject to word counts or page limits, and that forces us to be maybe too overly concise in the reporting of our mixed methods research and some of our reflexive practice. So, to the extent possible, we encourage trying to ask, journal editors and other journal decision makers for more space to be able to expand on some of these important topics. Next slide. I wanted to provide an example of how some journals and some of my mixed methods research were trying to really kind of showcase our positionality and transparency and who we are in writing up our mixed methods results. So this is a paper from some of my colleagues and myself. We were looking, it was a mixed methods study looking at the implementation of policies that earmark taxes for behavioral health. And so in this, we had a section that was specific to explaining how we ensured what strategies we used to enhance trustworthiness of our data. And so we had a section here that explained who we were as a qualitative coding team. So we said, in terms of our research characteristics and reflexivity, the qualitative team consisted of two mental health implementation researchers, public health policy researchers, and a public health and educational specialist research associate. Member checking was completed via the research team, presenting the interview findings to representatives of state-specific county professional organizations, and requesting feedback about general alignment between the findings and their experiences and perspectives. So we wanted to make it clear who we were as the research team and how we went about kind of confirming the qualitative findings with the community members who are part of our sample. Next slide, please. So our third issue, issue number 7 of our 13, but third issue within this category, addresses authorship inequities in team science. So within this issue, we think about team science can sometimes inflate authorship with those listed contributors who may or may not meet authorship criteria. And so some contributors may be excluded from work when it's not captured specifically or directly in it through writing. We want to highlight that there are other important contributions that may merit co-authorship that may not always be focused just on the writing and reporting of data. So we recommend applying standard authorship guidelines consistently. And these core criteria should include, first, that the person has made substantial contributions to the design, data analysis, data collection, data analysis, or interpretation of the research. It can include also that they've helped drafted the work, revised it critically, or reviewed sections of the write-up. We also encourage that co-authorship include approving the final version of the work and accepting accountability for the work. We want to encourage you to also watch for overlooked contributors with less institutional power, whose work and contributions were still substantial. And so next slide, please. What we've recommended, this is again, by no means a perfect kind of criteria checklist, but it's one method that we've used in terms of authorship guidelines. It comes from the International Committee of Medical Journal Editors, and they recommend authorship based on these criteria, some of which I just explained, but these criteria include, again, substantial contributions to the conception or design of the work, acquisition of the data or analysis and interpretation, drafting the work, reviewing it, final approval of the version to be published, and agreement to be accountable for all aspects of the work. So I think with that, I'm going to turn it over to Elise, who will take us through the third category of our ethical issues.
Okay, thank you. So in this last category of issues, we're going to consider inclusive and ethical involvement of human subjects. And you'll see that there are distinct ethical issues here, but our key recommendations are again going to center on our old friends, transparency and reflexivity. So you can go on to the next slide, please. Mixed methods research is usually involving large sample sizes, and the need for those large sample sizes can also increase the appeal of simple and low-cost recruitment strategies. that bring up concerns about equitable recruitment. These might be QR codes for prospective participants, those kinds of strategies that are low cost and easy. But these types of strategies, especially the ones that involve technology or broadband internet access, can disadvantage folks that have either limited technological proficiency or limited access to internet. They might live in remote or rural areas, for example. And then the representativeness of the study sample can be compromised in that way. And then at the same time, or an additional issue is that when projects involve recruitment for multiple phases, or they might want subsamples of participants, it can also be easy to kind of lean on the simplest recruitment methods and not clearly justify selection criteria for those kind of subsamples. So given these possibilities, it's important for us as researchers to prioritize equitable recruitment of participants across both quantitative and qualitative data collection activities, particularly when there's a need for a representative sample. So this might include making a concerted effort to include folks with varying levels of technological literacy and access. It might include efforts to include folks with different language preferences, and also thinking about folks who might have less time to participate in research. We recommend sort of those old-fashioned multi-pronged recruitment approaches like paper-based advertisements and in-person recruitment at different kinds of places like health clinics and community events. Those things are labor-intensive and require us to, go outside of our bubbles, but they are also more equitable and representative. And then there's also a need to be really thoughtful about sampling frames, especially in sequential designs where you're asking a subset of participants from one sample to participate in another form of data collection. So decisions about how you're sampling that subset need to be transparent, clearly documented, and well justified. You can go on to the next one, please. The next issue here is about complex consent procedures. So using both qualitative and quantitative methods can complicate consent procedures because mixed method studies might involve, different sets of expectations for different data collection methods, different risks and different benefits. The added complexity can then sorry, we have hold on one second. We've got a noisy child here in the background. Sorry about that. The added complexity then can make consent procedures more burdensome for everybody and introduces the risk of cutting corners and inadequately providing information to potential participants. So when we're planning mixed methods projects, it's important to plan for consent procedures that might involve this more complex information and that might be more time intensive to undertake. And fortunately, there are, growing numbers of alternative consent formats that we can really draw from, like videos or live walkthroughs that can be done virtually or by phone or in person. If studies involve multiple data collection events, then that might also require repeated or supplemented consent processes. And at the very least, we need to kind of frequently remind participants about the expectations and risks and benefits of the research and how their data is going to be used along the whole course of the research. And then one other important aspect here is making sure to clearly describe how we obtain consent in reports and publications. So that's another piece that can kind of easily get ignored. In the next slide, please, we outlined a few practical considerations for designing consent procedures in a mixed methods project. You can develop a consent matrix that pulls together, what you need to collect from whom and when and what stage. You can make sure to use accessible language and consent formats. You can plan to reconsent folks when new procedures are added, and don't assume that prior consents cover additional risks or new risks. You can make sure to document consent practices in your publications, and you can plan for participants who want to withdraw from the research and how their data will be handled. And then finally, keep an eye out for signs that consent or research procedures are too burdensome. So it's a good idea to track dropout and refusal rates, but then also to be talking to participants throughout, getting their feedback about how burdensome those procedures are. Next one, please. We included this article here from the journal Qualitative Research, which includes a really interesting discussion of how our standard understandings of consent reflect a very specific sociocultural perspective that sees knowledge as something that's transacted between individuals, right? So I give you information about this study, and then you give me your consent. But consent in this perspective is kind of one-time, instrumental. We do it to sort of satisfy our institutional and legal obligations. But then in this article, there's a really interesting discussion about the implications of understanding consent as sort of an aspect of relationship. In other words, that as a relationship of trust and reciprocity that we kind of co-produce with participants and continuously renegotiate over time. And that involves, the way that we behave and act toward participants within and outside of like the consenting process, in case folks want to look at that more deeply. Next one, please. Next issue, participant burden and compensation. So in addition to more complex and burdensome consent procedures, mixed methods research can also be extra burdensome because we might be asking folks to share both quantitative and qualitative data. We might be asking them to participate in multiple data collection procedures or multiple events, and figuring out appropriate compensation can be really tricky in this context. So in that context, it's very important to spend the time before starting data collection to really consult with folks who live and work in the research setting in order to determine the right compensation amount that is commensurate with the research burden, but not coercive. And like consent, compensation might need to be adjusted over the course of the study as you get feedback about how burdensome things might be. Next one, please. Shifting exemption status over time. So another consideration in complex and longitudinal mixed methods work is that some aspects of the research might initially be considered exempt, meaning that they're minimal or no risk to participants, and others might not, so they need more protections. But as projects evolve, exempt aspects can become non-exempt, depending on changes to the level of risk. And so research teams need to be prepared to make changes and to document their changes to their human subjects protocols as those things might change over time. Next one, please. Next, this is the one on everybody's mind. We need to think deeply about the challenges of contemporary threats to participant privacy and confidentiality, especially in team science, especially in virtual environments, and especially in the context of AI. So for example, when we're participating in team meetings or we're debriefing data collection events or we're working with participant bodies like community advisory boards, it's easy to kind of inadvertently share things that are traceable to specific people or organizations. When data collection is happening virtually, which it often is, that introduces particular risks to participants, especially since we kind of have a continuously developing understanding of what secure data storage really is and whether or not data can ever sort of truly be erased. Funders also increasingly want us to put data in public repositories, and so we have to exercise caution around anonymity in those situations. And extra caution is warranted with AI tools that are interacting with research data, and they may or may not meet confidentiality, security, or HIPAA requirements. So overall, we need to look really closely and monitor very closely how personally identifiable data are linked to participants and how those data are stored at every stage of the research and throughout the lifespan of the project. And this really includes continuous education as we try to understand what these evolving risks are and what the different tools are. Next one, please. So on that topic, we put together a slide here on AI specifically. Folks obviously are increasingly using AI tools in research. This one focuses specifically on qualitative research. We might use AI to transcribe audio, to assist in qualitative analysis, or maybe to even write reports and publications. And so as we do so, we need to be aware of what data is being stored and where. And to make conscious and careful decisions about how we use these tools. So These boxes talk about the different ways that data might be stored, what kinds of security standards these different tools might adhere to, and they vary from tool to tool. So that requires some really careful decision making as we use these tools. And then, for example, thinking about things like if you're using, ChatGPT, for example, to write a paper, um, entering participant quotes into ChatGPT, might represent a violation of confidentiality, even if you're just using it to write. So thinking about some of those issues. Next one, please. This next piece outlines some specific ethical issues with regard to the use of AI in research. So beyond security and confidentiality, there's a need to consider issues that are specific to our research projects, like algorithmic bias, how that might introduce bias and error into our models. Um, Issues of transparency, so where decisions might be made in kind of a black box capacity, and consent. So thinking about, again, what's happening to participants' data and where it's going that they may or may not consent to. At the same time, as we consider using these tools, we also are implicated then in broader ethical and values questions about AI, whether we like it or not, including labor questions about the hidden labor behind systems, issues of displacement and de-skilling of labor, questions about accountability for the harms of AI and oversight, and issues about the public good, including the climate and resource costs of AI. Okay, next slide, please. And this is the last one here, provider and participant dual roles. So a lot of mixed methods projects, and including a lot of the work that all of us do here, occurs in health and human service delivery contexts, and it involves working with service providers to recruit participants, to engage them in projects, to implement interventions, to do fidelity checklists, to provide data, a lot of those different aspects. And so once again, we need to consider the specific challenges that these requirements present to service providers and to clients. So, for example, asking folks to implement new practices and programs, do fidelity checklists, and participate in data collection can create a lot of stress for providers whose primary, priority is to address client needs. And we've seen that kind of over and over again in the research. Involving providers in recruitment also can place them in a kind of a difficult situation if clients start feeling like they have to participate in research to get the services they need. And so ultimately, we have the responsibility to genuinely collaborate with service providers and recipients and to kind of consider the ripple effects of the things that we're asking them to do. This also includes involving people with lived experience and their providers in decision making about, what's appropriate for recruitment, consent, and data collection. These might involve trade-offs. We might not be able to do everything we want to do, and those need to be considered transparently. Next one, please. And so to conclude this section, I just want to highlight the possibilities of really enhancing collaborative partnerships in mixed methods research. There's a spectrum of collaboration and research that you see here. This is one version of it, beginning with kind of simply sharing information and findings on the one side, on the left side, and continuing through consultation and involvement of community or organization partners in decisions, all the way to the full kind of co-creation of research on the right side. And of course, not every project is fully co-led, with non-research partners. But it's important to think about, where we might be able to build in more collaboration in our mixed methods and implementation studies. And just to provide some sort of food for thought in that direction, on the next slide, please. I like to point people to folks. I like to point folks to this project in thinking of kind of a genuinely co-created research partnership. This study is a rigorously mixed methods study. So it uses a lot of quantitative and qualitative data, multiple methods, multi-phase, multi-year intervention project to prevent suicide and alcohol abuse among youth, Alaskan Yupik youth. This whole journal, I'm sorry, this whole issue of the American Journal of Community Psychology describes the different aspects of this project. But if you are interested in sort of practical inspiration and guidance on a kind of co-development of merging quantitative, qualitative, and traditional knowledge production practices and community input and community leadership, this is a really nice place for some food for thought on the possibilities of collaboration, transparency, and reflexivity. And so then I'm going to turn it back to Nicole for the next section.
Thanks, Elise. We have just a couple of wrap-up slides. I appreciate we have about 9 minutes left. People are starting to maybe need to log off. So we have our evaluation survey in the chat here in case you're able to take that before you leave us. So I just want to wrap up with implications of what this means for your mixed methods research practice. So we have some thoughts across kind of the lifespan of your research here. So at the design stage, we encourage you to plan for some of these ethical considerations at the start of your project. If you can map your data collection, recruitment, and consent processes prior to IRB submission. During the formation of your mixed methods research team, do your best to understand each of your team members' methodological and lived expertise and values. Set psychological safety norms for your team at the outset. During the conduct and analysis of your research project, hold regular analytic memos and reflexivity sessions. Those periodic reflection meetings that Catie shared about can be really, really meaningful and important ways for people just to pause and take a moment to understand what the kind of the research process and progress is looking like. At publication and kind of during the dissemination phase of your project, report consent, authorship, positionality, and divergent findings transparently. Across the lifespan of your project, do consider whether you need to reassess ethics with each data wave, and as AI and other digital platform tools change and become more prominent in use. And then, importantly, with your community partners, especially in the context of your implementation research, partner authentically with community. Co-design recruitment and consent and credit their contributions as meaningful and authentically as possible. Next slide, please. So we have a few resources that we'd like to leave you with, a few different seminal book chapters and papers about mixed methods research and ethical considerations. These will all be included in a PDF of our slides that we'll send out to you after the presentation today. And then I think on our last slide here, we have our contact information if you'd like to continue the conversation offline. But I think with that, why don't we can stop sharing, Anna, and we have about 5 minutes for any questions, comments, um, disagreements. We welcome any of those. I'll see if there's anything in the chat here.
Or new items to add to the list.
Yes, please.
We did it. All ethical issues solved.
I knew we could.
Well, Catie and Elise, since AI is really such a hot topic these days, I'm curious from your own recent work how you've been using AI or not. I'm curious about your practice there.
Um, I mean, to be honest, I sort of have, inserted head firmly in sand. I sort of avoid, avoid. I don't trust it, don't like it, don't like the environmental implications, don't use it.
I mean, I will admit to using it for PowerPoints in particular.
Mhm.
I found it to be very invaluable. Except then when you realize everything looks like it was produced by AI, you feel like doing it the old-fashioned way. Um, but I do harbor the same concerns that Elise just expressed, especially in terms of the hidden labor that goes into making AI work. I mean, there's a whole like labor force out there that's underpaid, that's being taken advantage of, being exploited. And I don't think there's enough attention to what's happening on that front. And as you become more aware, you become increasingly reluctant to fully embrace the technology.
Mhm.
What about you, Nicole?
I'm similar to you, Katie, in that I have been using it for automating some tasks, including and organizing data. I mean, full transparency, we did note this at the beginning. We used it was Claude, Katie, to organize our PowerPoint presentation today. So I've found it useful for those types of tasks. But I have been increasingly concerned about not only the unhidden human labor, but then the unhidden or the hidden environmental impacts too. These models take a lot of resources to run, um, and so being mindful about just if we can use them, efficiently and in the responsible ways. I'm trying to think about how to do so. Will, do you have some thoughts about AI or any of the issues that we raised?
No, I just wanted to bring up, just since there was a deep discussion on reflexivity. Now you're talking about AI. I think within the last couple of months, the two of the developers of reflexive thematic analysis, I think they might be the Virginia Clark and Virginia Braun and Victoria Clark, two reflexive analysis developers, they penned an open letter basically saying that artificial large language models cannot do reflexive thematic analysis, so they're deeply oppositional to it. So if that's a consideration for people using these methods, I don't necessarily agree with them, but I just thought I'd point that
It
out.
was signed by like close to 150 people.
Mhm, mhm, mhm.
There was a stance taken for
Yeah,
sure.
yeah, yeah.
Well, and I think there's just a lot of reason to be very suspicious about the security of it as well. I mean, there's supposedly, there are different tools say that they have different, requirements and security procedures and in terms of uploading things to the cloud and where that data goes. But I think there's a lot of reason we've seen to be distrustful of what happens to data that gets uploaded into AI and that you lose control of it. So I think
Mhm.
I don't really know what needs to happen to be able to trust it to not, disperse into the universe.
Yeah, I would say you can't fully trust it, but that's my take. We have to be careful and scrutinize what we're doing and what we're getting back from AI, because it's up to us what we finally send out into the world. Yeah.
And what we receive back. I mean, as people, we can have control over how we use it, but we don't necessarily have control over how others use it and then share it. And then we're, consumers of that. So,
I
um,
always wondered about like the positionality of AI then, right? Like if you're using that as another qualitative coder, right? How do you describe that? And then, what's the importance of AI as a coder then? I don't know. Theoretically, I think it's interesting.
Well, and there's all these questions that I haven't explored, but like how are you humanizing AI? And people treating AI as their collaborator, their work partner, but like actually using this kind of like the affected kind of like approach to it, saying please and thank you to AI.
mhm.
I did also have a really interesting discussion with some students last week about they were very concerned about like public data repositories and then also AI in terms of confidentiality. We were specifically talking about like tribal data, and they were talking about like what do you do if you can't ensure that data is not going to get out there. And so we had a conversation about, if there's really data that you don't want out there, there's also data that you don't have to collect. Like you can't lose control of data that you don't collect. And so making some of that, there might be some hard choices about, if it's really that sensitive, maybe we need to think differently about how we actually collect data in the first place.
Although that's really interesting too, is that there's all these conflicting pressures. Communities want the data because it can help them improve programming, it can help them achieve better outcomes, and then funders are mandating participation in
Mhm.
these types of public repositories.
Mhm.
But you,
So there's ethics in both collecting and then deciding not to collect data too. That could be important for some
the funding
communities.
forces.
Well,
Mhm.
also determining what you would share in the public repository, for example. It may not be all of the data that you collect. It may be the main outcomes you have listed on clinicaltrials.gov, for example. That's what may be required or um, strongly asked for, I should say. So I think we have some choices there as well.
And I know we're shutting down in a moment, but it does remind me when I was doing that postdoc back in the day, it was all about, findings for the universal good. There was this whole universalizing discourse about why we're doing this work. We're contributing to something greater that's going to help everybody. But of course, if you're engaged in like community work, the critique there. Um, but here we're just in these really interesting circumstances, and it seems like from our presentation today, we were kind of like going against that universalizing impulse.
Well, with that, we'll need to wrap up today's session. Thank you so much, Elise and Catie. Thank you all for joining us. Enjoy some holiday time off over the next few months, and we'll see you all back here in September. Thanks, everyone, and take good care.